Good evening, and thank you for joining us. This is a question I've been sort of asking myself, and I know a lot of people are also asking this question of when will the pandemic end? Are we in an endless cycle of waves, and is this what the rest of the next few years are going to look like? Is there any sort of end point to this pandemic, especially when we look overseas and we see most of the other countries now bracing for their third wave, their fourth wave? One wonders what that end point is. I've also received feedback recently from a regular viewer who told me that I don't spend enough time introducing our guests and talking about their profiles and why we have invited them on the show and why we think they're specifically qualified. So I think that this is a good day to start. Because to answer our question of when this pandemic will end, this evening we've invited Dr. and Professor Srinath Reddy, who's the president of the Public Health Foundation of India. He is India's foremost public health expert. He was also the former head of the Department of Cardiology at the Indian Institute of Medical Sciences, a Padma Bhushan awardee, the first Indian to be elected to the National Academy of Medicine in the US. He gave up his, his private practice or his, wonderful career in cardiology to look at public health because he believed that that is where the real problem lies. The decisions that we make for public health and how that affects everyone's health in general. And he started doing this many years ago, which puts him in a unique position to comment on the pandemic, India's handling of the pandemic, and where we are right now, which is why, and I'm also so grateful that he's been kind enough to give us his time as well. Professor Reddy, good evening, and thank you for joining us. It is a pleasure to speak with you as always. You have, in your advice to the Odisha government, told the Odisha government that a third wave is now imminent. In a previous interview to a different channel, you did say that there are some parts of our country that are seeing a prolonged second wave, and there are some parts that are seeing a likely eruption of a third wave. Are we going to be in an endless cycle of waves, Doc?
Okay, let me first clarify one area.
Yes.
I've never been in private practice.
Okay, I'm sorry. I apologize.
No, that doesn't matter. All through, I've been in my professional career, been at the All India Institute of Medical Sciences after having graduated from the Osmania Medical College. And when I left the All India Institute of Medical Sciences, while I still had several years of tenure left as head of the department, it was to take up the leadership of the Public Health Foundation of India. So I've never had to take money from any patient. So that was, and I wanted to remain that way. And even if I do offer advice now to some people, it is on a friendly basis and not on a transactional basis. That doesn't mean that people who take money from patients are not good doctors. My mother herself was an honorary physician. She was an obstetrician gynecologist. And she did have private practice, but she never charged for her patients. So there are different levels of value systems. But just wanted to correct that, lest anybody think that I'm a refugee from private practice. No, very much from the All India Institute of Medical Science. Well, your question about where the third wave is beginning and when will it come, and whether there'll ever be an end to this pandemic, let us recognize that when we say end, what does it mean? Is it that the virus will be completely eliminated from this planet and will not affect anybody? If that is the conception, that's not going to happen. The virus will very much remain, whether it will grow milder and milder and have a less opportunity to infect people in a very severe fashion and cause a lot of deaths, that certainly can happen. Now, we have had people and countries actually saying that they will have zero COVID. China went the zero COVID route, having millions tested almost simultaneously in a matter of a few days in Wuhan or elsewhere. They went into lockdowns. They introduced the concept of lockdowns to the world. Australia and New Zealand sort of became sort of refugee islands. I mean, they completely locked themselves up. And then they became fortress islands. And we have seen what's happening. You cannot completely prevent the ingress of the virus. However careful you are, the virus will travel with somebody. And the important thing is to restrain the virus from infecting a large number of people till the vast majority are vaccinated, so that you do not have very severe disease and fatalities, and nudge the virus over a period of time to become milder, even if it is going to remain in our midst, so that it's not going to be a virulent virus. It may take several decades to become as mild as the common cold virus, but certainly we can get it to step down in terms of its virulence. And if we protect people, even if it becomes infectious in its virulent form and variant form, in its variant form, it is unlikely to cause a serious amount of disease. That's the end point that we ought to be really looking for, not to see the end of the virus completely. To that extent is achievable. We do have potent vaccines now, which are very effective. We have vaccines which can still be modified against the new variants. And therefore, it is still possible that if we have a huge amount of vaccination across the entire world, firstly, we are protecting people. Secondly, we are giving less opportunity for the virus to develop new variants. The more opportunity we have for the virus to spread fast and in a very less vaccinated population, then we are giving the virus a great opportunity to experiment and come up with new variants, which can be quite problematic for us to handle. So the short answer is, yes, we'll probably have a third wave. Most countries will have till they have higher levels of vaccination. We will have a third wave in terms of cases. We may not have third wave in a huge number of deaths, because many people might have acquired immunity by infection or by vaccination. But the more we vaccinate, the smaller will be the third wave.
So I have a couple of questions about this, and we've come to, you did say vaccinate the whole world, right? And we have the UN and the WHO constantly be concerned about the fact that while Western countries that have monopolized about 70% of the vaccine manufacturing are now doing the third booster dose, there are countries across Asia and Africa who have not received any doses at all. And that is concerning. So is it possible, and we saw the Delta variant that's currently terrorizing most of the world actually come out of India, is it possible that the next sort of scary variant might come out of Africa, where we've not shared, I mean, the world has not shared vaccines with Africa right now, and that could be a reason for worry?
Absolutely. What the Western countries, the high-income countries are not recognizing is that if they let other countries have huge breakouts of infections, if a very large number of people are still very vulnerable and susceptible, and if you're going to allow the virus to infect and stay on in a large number of people, to giving it an opportunity for mutation easily, then those variants which come out from there are likely to somehow, sometimes spread into these countries as well. They cannot completely lock themselves out. And they will find the variant coming in, if not from India, it will come in from South Africa, it will come in from Peru, it will come in from somewhere else. Therefore, it's absolutely important for them, even in terms of enlightened self-interest, if not altruism, to try and share the vaccines and try and get the whole world vaccinated. Having said that, they are saying that there are still vulnerable people who are either very elderly or immunocompromised, and they may need higher levels of protection because they might not have developed adequate immunity with the 2 doses of vaccination. If that is the argument, even the WHO says that is fine. If there are a few people who are immunocompromised, then go ahead and vaccinate them. But you cannot really shut the door then. The moment you send out a signal to your population that 2 doses of vaccine may not be enough, even people who may not be immunocompromised, who might have reasonably good immune response, will be lining up because they're all anxious. They all feel vulnerable. And that is where the United States will also see, and the UK will see, a large number of people lining up for their third doses, even those who do not need it. And that is going to cost the rest of the world in terms of vaccine availability. And that's going to be the big challenge ahead.
Doc, we also have in India, if you look at India's numbers right now, less than 10% of our population is fully vaccinated. There's a larger number, we understand, of people who've received one dose. Where does that leave us? If we look at now, like you said, the possibility of variants coming out of the unvaccinated parts of the world, like you said, you can't really, especially a country like India, cannot be turned into a fortress. So the vaccine will travel, its variants will travel. How vulnerable does that leave us as a country and as a people?
We are indeed vulnerable. I think our first task is to try and protect the most vulnerable sections of our population. That means the elderly and those who have severe comorbidities and therefore are likely to be vulnerable to severe infection and possibly death. So whatever limited stocks we have, we ought to utilize to protect the most vulnerable. Then, if we are going to be getting more vaccines or scale up the production of the already available vaccines, as the government is saying, in the next few weeks, and then maybe step up our vaccine availability over the next few months, and then we should be able to vaccinate others also with greater speed. But till we reach at least 80% of vaccination across the country, I do not think we can live with the assurance that we will not have either spikes coming up now and then, or even possibility of large waves if we are careless enough to allow the virus to spread easily.
You've also, if I'm not mistaken, you've said that the virus will be given, the virus will come back and the numbers will go up if we give it a free run. It really depends on our behavior. And we're at that cusp again. There's a little bit of deja vu about, I apologize. There's a little bit of deja vu about what's going on in our country right now because we're entering the festive season. There is the Independence Day celebration. I just read out a story in our news bulletin where state governments have said a maximum of 1,000 people at an Independence Day celebration. Now, that's a large number. We'll go into festivals immediately after that in August, September, October, November, and so on. How, when you say depending on our behavior, what should that behavior ideally be?
Well, I think we ought to reinforce the message that a very large number of people are still susceptible. Even if you take the antibody surveys at face value, and you can't take them at face value, because all that they have done is detect antibodies, not measure their neutralizing capacity. So we are not sure that even those who have antibodies are currently protected or are likely to be protected in the short run. But even if we take those values, there are a very large number of people who are still unprotected in this country. And the moment you have the virus infecting those people, then it can actually develop into new variants, and they can endanger even people who have been vaccinated. So whether it is the original virus or the current variant or a new variant yet to spring up, the best way of preventing it is through masks, ensuring that you move in ventilated spaces and avoid large crowds till we cross at least that 80% vaccination rate across the country. Now, it is possible that given the fact that many people may have been exposed to the virus, even at slightly lower levels of complete vaccination, we may achieve a considerable amount of protection. But we want long-lasting protection, at least for a year or more, then we ought to depend on the vaccines rather than on just the chance infection alone.
Yes. So that brings me, and you did, you did mention it yourself. I was going to be my next question about the Serosurvey, but the ICMR Serosurvey said that cities like Delhi, states like Delhi, for example, are better off because more than 2/3 of their population, including children, have already, are showing signs of antibodies in their system, which one assumes they may have got from unknowingly being carriers of COVID. Other states like Kerala, the numbers were lower, it was closer to 40%. Two questions here. you've said it does not mean that everyone who is showing antibodies is immune to COVID, and so we shouldn't let our guard down. So what does that mean, say, for Delhi, that's currently eating at restaurants, going to malls, partying, behaving as if nothing happened, as sort of suffering from amnesia over what has happened over the last few months? And what does that mean for Kerala, which is showing numbers of more than 20,000 cases a day right now?
Well, firstly, Delhi last year claimed that we had 55% Serosurvey positivity and said we have achieved herd immunity. Then came the Alpha variant. Then the cases started going up. And then came the Delta variant. And you have seen how savage the second wave has been, despite the claimed herd immunity. So we cannot really say that the 65 or 70% positivity now is fully protective. Yes, many people are unlikely to get serious infection and death if they're already protected by adequate amount of neutralizing antibodies and T-cell immunity in their body. But they are still vulnerable if those levels wane very fast or if a new variant comes in. So you have to continue to keep yourself fully protected. The reason why we emphasize vaccines more than natural infection is that it is likely that the natural infection might have had a very low viral load, and therefore, even if you have antibodies, they fade fast. Therefore, you may not have a long-lasting immunity, whereas a vaccine with a standardized dose gives better immunity, and if there is also a priming and a booster dose, you are likely to get a much better immunity. But I don't think Delhi can be careless. As far as Kerala is concerned, they are now seeing the effect of the Delta strike. They protected themselves fairly well against the wild virus and even against the Alpha variant through their containment measures, which meant that a large number of susceptible people still remain. And when the Delta virus hit with full fury, then there were many people affected. But again, if they can continue to maintain their public health measures, they can slow down the transmission still. You may still see a protracted second wave, but you may not see as many deaths if you're able to protect many of the people with vaccines in the meanwhile.
So we have a question. This comes up. This has come up a couple of times. Is Kerala is a failure because it has daily cases touching 20,000, and this is actually a little confusing because you did say, and before you on Friday, Dr. Shahid Jamil also said that it's because Kerala's model is working that they were able to protect themselves the first time around, which is why they're seeing a controlled 20,000 cases. Do you agree with that, or do you think that Kerala is doing something wrong at this point?
Well, let us look at what we define as success and what we define as failure. If we are defining as failure a number of cases or persons being infected over a period of time, that indeed is a failure of public health measures. But the speed at which these numbers rise, that is reflective of how successful your public health containment measures were. To that extent, compared to many other states in the country, Kerala succeeded in slowing down the transmission. If we look at failure as the inability to prevent a large number of hospitalization cases and a large number of deaths, then Kerala has managed fairly well in terms of not having hospitals crowded. And certainly the death rates have not been as high, though they certainly could do better. It is true that Kerala, with its higher crowd density and older population, has had many more people hit during the Delta wave because they still had many susceptible people. So the Delta strike was more severe in Kerala than in some other parts of India where already many people were exposed to the virus earlier and had some residual immunity. Therefore, we'll have to look at what Kerala has done right and what Kerala could still do much better. Where it could do much better is continue the containment, not relax, and ensure that their hospitalization is prompt and adequate to prevent deaths. The critical element at the end of the pandemic or at the end of whatever waves we call is going to be how many deaths.
Doc, you have an advisory position with the government of Odisha. You have I read in an article said that Odisha needs to now brace itself for a third wave, if I'm not mistaken. Is what Kerala is experiencing, is that the prolonged second wave, is the beginning of the third wave? Is it likely to spread to other states? We've seen Karnataka and Tamil Nadu now sort of become more vigilant on their borders with the state of Kerala. When is this third wave expected in Odisha, according to you?
No, we have basically not predicted any calendar. The whole question is, have we declared that Odisha or any other state will never have a third wave? That is where the answer is no. You should be prepared for a third wave. You don't know when it will come. Try and delay it as much as possible. Try and keep it as low as possible. And if you're well prepared, you may actually manage with a little ripple rather than a tidal wave. But you have to be prepared for it because there is still a fairly large vulnerable population existing in almost every state, including Odisha. So the idea was to caution, because the idea of herd immunity has been going around so many times that many people think that, okay, we have attained the nirvana. There is no question of our being vulnerable. So that caution needs to be sounded even now.
I also want to point out to you, and we've had several conversations about the vaccine policy. And in all of those conversations, we said, yes, we've started off with 2 vaccines. We have Covishield, we have Covaxin. This is the speed at which they are manufacturing. And hopefully over a period of time, we'll have maybe Johnson & Johnson, Moderna, Pfizer, some of these other guys come in, more approvals, more vaccines, being developed in India. But, from the time we started this conversation, we're still only at 2. Johnson & Johnson says that their process of approval in India is not complete. We don't really have access to any of the other vaccines other than the 2 we started off with. Is there a reason for the delay? And do you think that this would make a massive difference for us if we had more options on the ground?
Well, I've just seen a flash today saying that Johnson & Johnson has been approved, and before that, Novavax has been approved. So I think they are now rushing through the approvals faster than before. So I think we are going to see some of these foreign approved vaccines start manufacturing soon, if not actually imports. At least the Indian manufacturer, Novavax, will start with Serum Institute and Johnson & Johnson at Biological E. So I think that process is going on. I think where we are having the struggle in terms of negotiation is with the mRNA vaccines, that is Pfizer and Moderna. So that's where I think the negotiations are still protracted.
Would you also, Doc, recommend that India right now, while there are a lot of young people who have received 1 dose, that we buckle down and focus on giving 2 doses to our vulnerable population across all of our villages as well? Because we need to, like you had said in a previous conversation, focus on that population first before trying to spread ourselves too thin.
I still maintain that the main purpose of the vaccines is to prevent serious illness and death among the most vulnerable. And therefore, we have to define who are the most vulnerable and try and protect them as much as possible. Now, for example, there is some discussion going on whether healthcare workers should be given a booster dose, not only here, but in other countries, considering them to be very vulnerable. Now, I would say define vulnerable in whatever manner, but certainly the elderly and people with comorbidities are the people who qualify most. And if you can give them the 2 doses preferentially, and others are covered with 1 dose till more doses become available, that's a reasonable policy of protecting the people who are most vulnerable and giving at least partial protection to those who can withstand the infection much better.
What is your advice right now for various state governments who are going to be navigating the festive season in terms of restrictions? Obviously, I know that you strongly still believe in masking and ventilation, but in terms of public gatherings?
I'm opposed to large public gatherings. I mean, people will have to get back to work. People will have to get back to studies, and I'm in favor of opening schools with adequate precautions and vaccinating the school personnel who I regard as essential workers. So we have to get back because we do not know how prolonged this is going to be. and therefore we have to resume some of our activities. But we can still avoid crowds. We can avoid, crowded gatherings in ill-ventilated places. Those are the things that we must certainly take precaution. And whether in schools, whether we manage with shifts, whether we manage with alternate days, how do we want to do it? All of those are things to be worked out. But certainly having gratuitous gatherings of a large size, purely of a celebratory nature, I think is totally unwise, and I think they should be avoided.
All right. Professor Dr. K. Srinath Reddy, thank you so much for speaking with us and giving us your advice. I appreciate the time and the advice that you give us every time. You've always been very generous with your time, and our audience always benefits from these conversations. Thank you so much.
Most welcome. Parting words are that we are padding up for the third wave even before the second wave has declared its innings everywhere in India. There are still parts of India where the second wave is still batting. So let's face that. Okay.
Thank you. Thank you, Doc. Thank you. For our audience, remember the news is up at 9 o'clock. You can take a look at our news updates for today. Thank you for watching.